Welcome back. You're still tuned into the PM edition of Newsfeed. We're having a discussion about various mental health disorders, including depression, but also just a recap of how the world marked World Mental Health Day. And my guest in studio is Megan Hosking, who is a psychiatric intake clinician at Akeso, and Dr. Alicia Porter, who is a psychiatrist and a member of the South African Society of Psychiatrists. I mean, the biggest thing about mental illness is that people are unable to identify the symptoms, even as those looking at their friends and saying, well, my friend may have a problem, but I'm not too sure where to go. So the question is, where do people go and who do they approach? A psychiatrist, a psychologist? What is the difference?
So there's lots of different options for seeking that first step. For many people, I think many people end up at their GP as a starting point. They say, well, I'm realizing, like we said earlier, sometimes it's physical symptoms as well. So I'm realizing something's not okay, and they'll go to their GP, who they may then make a diagnosis. And in a lot of cases, that is sufficient for people, but a lot of times people do need to seek then a specialist opinion, which is then that of the psychiatrist from a medication perspective. But that's only one part of the more holistic treatment, which is always encouraged. And the other part is the therapeutic part. So whether that is a counselor, a psychologist, a social worker, something like a support group where you can share your experiences. But most of the time, that combination of the therapy and the medication is where the most rapid improvement is seen, especially if the person does require the medication.
Yeah, I mean, the economics of it is mind-blowing. I mean, if you would like to see a psychologist, a session could cost anything between 1.5 to around 2.5 thousand rands. Do you think that's really preventing people from accessing crucial health care like that?
Yeah. So we have huge challenges both in the private and the public sector in terms of access to health care. Because, for example, a condition like depression in the private health care sector, it may be considered what we call a prescribed minimum benefit. So you can access like 15 sessions with a psychologist and psychiatrist combined. But the medication would not then be covered under the chronic illness benefit. So you may get the therapy and the consultations covered, but the medication would then not be covered. And again, also in the public healthcare sector, access, so the public healthcare sector is geared to deal with severe mental health disorders like your psychotic disorders and your bipolar mood disorders. But your common mental health disorders like anxiety and depression, there's a huge challenge in accessing care, waiting lists, shortage of beds, shortage of medication. So it really is a challenge. We have organizations like the South African Depression and Anxiety Group, Lifeline, but those provide more crisis intervention.
Not necessarily preventative. And we will be picking up on some of the tweets that you guys have sent us concerning this topic. But there's always a debate about how to treat various mental illness disorders, whether we do so via medicine, psychotherapy, both, or excluding medicine. Some people even saying that, using medicine either makes one even worse and there is no change. What would your advice be?
So I often use the analogy of surgery, and we usually would grade a depression. You'd have mild, moderate and severe. Obviously in mild depression you may not necessarily need medication, but when you get moderate or severe you would need medication. So I would often say to clients, just like you wouldn't have surgery without an anesthetic, why would you choose to go through a therapeutic process without medication?
Definitely.
It just makes the process a lot more manageable, and it helps with the discomfort of dealing with the emotional aspect. And so there's a lot of stigma surrounding medication.
And it's a really touchy...
do you want to add on that?
It's a very touchy subject for a lot of people. And in a lot of cases that we deal with, some people are willing to take the medication, but it's their families or their friends that are encouraging them not to. Which can obviously be a big problem, because especially if you're experiencing a more severe mental illness, the consequences of not being on that medication certainly outweighs
Yep.
any maybe minor discomfort you're experiencing from it.
Indeed.
In many cases. But it is a difficult thing. It's a challenging decision for a lot of people to make on whether they want to take something like a medication. And I think that's why communication like that is so key in why it's important and what it means and what they can expect from the medication. And I'm a big advocate that there must be therapy in addition to the medication.
Yes,
so
definitely.
that can also help you to process that and the additional aspects of what you're dealing with.
Yeah.
All right, let's take a look at what you guys are saying on social media and the questions that you are asking. At Melissa Moore says, anxiety and depression have been part of my life. As long as I can recall, these increase and subside, but are always sort of there. I couldn't admit this for a long time. It feels good to accept myself and my experience of the world. I'm not alone and neither are you. Hashtag World Mental Health Day. And that's the beauty of social media, something that we were touching on earlier on about how people are, in a sense, coming out and sharing their stories as well. At Jim says, it's no longer hashtag World Mental Health Day, but I decided I'd talk about it today, not yesterday, because everyone who shared their struggles still have those struggles today and tomorrow and the day after. You have my support and my love every day. So a sad one also from Jim there. At Robin says, whilst it's late for hashtag World Mental Health Day, it's never too late to say that mental health of teachers, never too late to say that the mental health of teachers is so very important. Working with young people is a gift, but too many teachers leave the profession within the first 2 years because of a lack of support. I mean, that's also one thing that we touched on earlier. Depression in the workplace. It's not only affecting teachers, but also in South Africa, we've seen professions or professionals in the medical field taking a knock as a result of the important work that they do. But it's very interesting that these are the very people who are supposed to know everything about mental health, which speaks to the stigma really in that industry.
And it's actually a stigma that's so difficult to break, or that silence, because it's the idea that I am the healer, therefore I should not be unwell. So it really is about, or the challenge is now to break the silence and present platforms where these difficult topics can actually be discussed and addressed in the medical fraternity.
Yeah. Megan, let me give you your last word. You're running out of time.
I think that's why supervision and proper support in any workplace environment is so important, especially if you're in a profession where you are dealing with people who are experiencing issues. First responders, for example, as well.
Yeah.
Big issues in those professions for a lot of people because of the nature of what they're doing, the amount of trauma they're experiencing, and the go nature of what they're doing doesn't really give you a chance to have a break. And that's the same thing, I think, for a lot of doctors, that the hours are just crazy in a lot of cases.
Just an interesting one before I let you go. I don't know if you've been, actually we've run out of time, but I wanted to talk about how people are noting how environmental climate change is also affecting people's moods and also being attributed to depression. But that is, of course, a conversation that we will continue to have here on Newzroom Africa, channel 405. I have been in conversation with Megan Hosking, who is a psychiatric intake clinician at Akeso, as well as Dr. Alicia Porter, who is a psychiatrist and a member of the South African Society of Psychiatrists. And of course, that's where I leave it. Don't go anywhere. My colleague Tami Ngubeni will bring you Weekend Prime.